Hey there, parents and soon-to-be parents. Welcome back to Milk Matters USA, the channel where we talk about everything baby, breastfeeding, and beyond. If you're wondering when it's the right time to introduce a pacifier to your baby, you're definitely not alone. In today's video, we're gonna break it all down for you: when to start, what to watch for, and how to do it right. So grab your coffee, take a deep breath, and let's talk pacifiers. Section 1. Why do babies love pacifiers? Okay, let's start with the basics. Babies are born with a strong sucking reflex. Sucking is soothing. It helps them calm down, feel secure, and sometimes even sleep better. That's why pacifiers can seem like little miracle tools when your baby just won't settle. But here's the big question: when's the right time to start using one? Section 2. Timing is everything. When to introduce a pacifier. So here's what most pediatricians and lactation consultants recommend. Baby bottle: if you're breastfeeding, it's usually best to wait until breastfeeding is well established before giving your baby a pacifier. That typically means waiting about 3 to 4 weeks. Why wait? Well, in those early weeks, your baby is still learning how to latch, how to feed, and how to build up your milk supply. Introducing a pacifier too early can sometimes cause nipple confusion or reduce how often your baby nurses. And less nursing can mean less milk production. Baby medium light skin tone: if you're formula feeding, there's a little more flexibility. You can introduce a pacifier a bit earlier, since you're not relying on that frequent nursing to build up milk supply. The key takeaway? Right finger: wait 3 to 4 weeks if breastfeeding. Right finger earlier is okay if you're not nursing and your baby is feeding well. Section 3. Signs your baby is ready for a pacifier. Here are a few signs your baby might be ready. They're gaining weight steadily, they're feeding well with a good latch, they seem to want to suck even after feeding, they're fussy or trying to self-soothe. If that sounds like your little one, and your pediatrician agrees, it might be a good time to give it a try. Section 4. How to introduce a pacifier safely. Here's how to introduce it without stress. Start when your baby is calm, not crying. Offer it after a feeding or when they're just a little fussy, not starving. Hold it gently to their lips. Let them suck it in themselves. Don't force it if they're not interested. Stay nearby. Make sure they're in a safe sleeping position, on their back, and never attach a pacifier to a string or clip while they sleep. Keep it clean. Wash it regularly and replace it when it starts to show wear. Section 5. Common questions parents ask. Q. Will using a pacifier affect my baby's teeth? A. Not in the early months. But prolonged use beyond age 2-3 might lead to dental issues. Most experts suggest weaning off by age 1 to 2. Q. Can pacifiers help prevent SIDS? Yes. Some studies suggest pacifiers used during naps and bedtime may reduce the risk of sudden infant death syndrome. Just don't reinsert it if it falls out once baby's asleep. Q. What if my baby doesn't like it? That's okay. Not all babies take to pacifiers, and that's totally normal. You can try again later, or just skip it altogether. Alright, parents, that's a wrap on pacifiers. Party popper. Just remember, every baby is different. Some love the pacifier, some ignore it completely. Whether you use one or not, you're doing amazing. Trust your instincts, follow your baby's lead, and don't forget to talk to your pediatrician if you're ever unsure. If this video helped you out, be sure to like, subscribe, and share it with a fellow parent who could use the info. 2 hearts. And if you've got questions about baby care, breastfeeding, or anything in between, drop a comment below. We read every single one. Until next time, keep loving on that baby, and remember, here at Milk Matters USA, you've got this. Biceps baby bottle.